Come in.
Hello.
Hi.
Hi. Are you Mike Jones?
Yes.
Okay. I'm Frank Cerna, the physician assistant with
Hi.
Dr. Howe.
Nice to meet you.
And I'm working with him today. And are you comfortable right now? Does everything seem okay?
Yeah.
All right. Today what we're going to do is I need to do a cardiac history and physical exam on you. And that will take about 20 minutes.
Okay.
Are we ready to go?
Yep.
Okay.
I'm ready.
All right. Okay, if you don't mind, is that okay if I sit here?
Yeah.
All right. Okay, so we're going to go through some questions first, just to give me a little better idea of what's going on as far as your heart health.
Okay.
Have you experienced any pain or tightness in your chest?
No.
Have you had any palpitations, racing heart, anything like that?
No.
Have you had any difficulty breathing?
No.
Have you had any episodes of dizziness, any fainting spells?
No.
Have you had any episodes where you feel like you're getting fatigued easily?
No.
Okay. Have you noticed any swelling in your legs?
No.
Okay. Have you noticed any bluish discoloration of your lips or your nail beds?
No.
Okay. Has anyone in your family or have you had a history of any kind of heart disease?
No.
Okay. How about a history of high cholesterol, you or anyone in your family that you know of?
No.
All right. Do you smoke?
No.
Okay. Have you ever smoked, used any kind of tobacco?
No.
All right. Do you drink any alcohol?
No.
Okay. Have you ever used any kind of recreational or illicit drugs?
No.
Okay. Are you taking any prescription medications?
No.
All right. And are you taking anything over the counter, like Tylenol, aspirin, any kind of over the counter meds?
No.
All right. And are you taking any kind of herbs, supplements, anything like that?
No.
All right. And do you have any history of allergies to medications?
No.
Okay. How about to latex?
No.
Okay. Very good. All right. So now that we're done with that, I'm going to start doing just a kind of a quick overall examination by looking at you and just to see if there's anything that appears out of the ordinary, all right?
Okay.
Okay, so at this point what I'm going to do though is I'm going to go wash my hands and then I'm going to put on some gloves, all right?
Okay.
Okay, so I'm just going to take a general look at you to see if there's anything that would give me any idea that you have a cardiac issue going on. So first I just want to take a look at the general appearance of the skin overall. And then I just want to take a look at your face to see if there's any evidence of any edema. I'm just going to take a quick look at your eyes. I'm going to take a quick look at your lips and your mouth open wide. Say, ah. I just want to see if there's any signs of central cyanosis. Okay, I'm going to take a quick look at the neck to see if there's any kind of abnormal pulsations that are there. Okay, then I'm just going to check the extremities to see if there's any signs of edema. And I'm going to take a look at the hands and the nails to see if there's any signs of cyanosis or clubbing. Check down here. I'm even going to check down to your ankles and make sure that there's no edema down here. Okay, so at this point I don't find anything unusual that would make me think that there's a cardiac problem, okay? Okay, at this point I'm just going to check your pulses in your wrists And make sure that you have a good radial pulse on each side. Okay. All right, so I'm going to check them both at the same time now. Okay, the heart rate was 68. The pulses are equal on each side and symmetric, regular rhythm, a good amplitude there. It's not weak or thready, and it's not bounding, and an equal and smooth rise upstroke and downstroke. Okay, so at this point, the pulses are normal and there's no abnormalities here, okay? So at this point, I need to take a look at your chest. So let's go ahead and bring this down. Okay, I would normally get blood pressure in both arms at this time as well, but at this point, we're just going to go ahead and do the rest of the exam first, all right? Okay, so first I just want to look to see if there's any scars or deformities and any abnormal pulsations. I don't see any pulsations or scars or deformities. And so now I'm going to touch your chest with the heel of my hand and with my fingers to see if there's any abnormal vibrations over your heart, okay? So I'm going to start at the second right intercostal space over the aortic area, okay, with the heel of the hand, and then I'm going to go to the left second intercostal space for the pulmonic area, go to the left third intercostal space for Erb's point, okay, go down to the left fourth and fifth intercostal space, and then go to the fifth intercostal space, mid-clavicular line for the apical and mitral area. And I'm going to use my fingertips now to check for the point of maximal impulse. There it is. Okay. And then I'm just going to check each of the heart valve areas again. Right intercostal space, second interspace, left intercostal space, third space, second space, left third intercostal space, fourth intercostal space, and then back down to the mitral area. Okay. And I didn't feel any abnormal vibrations or pulsations. Okay, at this point I'm going to start listening to your heart with my stethoscope. I'm going to listen twice. I'm going to start by listening with the diaphragm for high-pitched sounds, and then I'm going to listen with the bell for low-pitched sounds. Okay, when I ask you to, I may ask you to hold your breath or just breathe. For right now, just breathe normally unless I ask you to hold your breath or to take a big breath or let the breath out, okay? Okay, so I'm going to start at the right upper sternal border, right second intercostal space, and listen over the aortic area. Okay, I'm going to go to the pulmonic area. Okay, I'm going to go down to Erb's point. Okay, I'm going to go down to the fourth intercostal space, on the left, the tricuspid area. Okay, and I'm going to go to the fifth intercostal space, mid-clavicular line for the mitral and apical area. Okay, I'm now going to switch to the bell and do the same thing to pick up the low-pitched sounds. I'm going to start at the top again. Okay. Now what I need to do is I'm going to ask you to lean forward. I'm going to listen with the diaphragm only again. What I'll need you to do is take a deep breath in, let it out, and then hold it out until I ask you to breathe again. If you feel like you need to take a breath, go ahead and we'll just listen a second time, okay?
Okay.
All right, so I want you to go ahead and take a big deep breath in. Okay, let it all the way out. Okay, hold it all the way out and lean forward for me. Very good. Okay, you can go ahead and take a breath. Did you make it okay there?
Yeah.
Okay, all right. So at this point, I did not hear any abnormal murmurs or other abnormal sounds auscultating while you're sitting up. Okay, so at this point, I'm done with listening to your heart while you're sitting up. I'm going to ask you to lay down, and then I'm going to listen to your neck vessels and listen to your heart laying down. Okay, so at this point, we need to make sure that the patient is at a 25 to 30 degree angle, head up. And I'm going to start by looking at the carotid arteries. Are you comfortable in this position?
Yeah.
All right, let me have you look towards the left a little bit, and I'm just going to lightly touch and check for the carotid pulse here. Being careful not to put pressure on the carotid sinus. Okay, I want you to turn your head towards me just a little bit. Very good. I'm going to get the left carotid. Okay, very good. I'm going to check the carotid pulse and the apical pulse at the same time. Okay, and the timing is normal. Okay, good carotid upstroke and amplitude. Amplitude is not bounding or thready, and the upstroke is brisk and smooth on the upstroke and on the downstroke. Okay, so I'm going to listen to the carotid arteries on your neck with my stethoscope using the diaphragm and listen for any murmurs or bruits. And then I'm going to ask you to hold your breath while I'm listening, okay? Okay, take a breath in and hold it. Okay, breathe normally. Okay. Okay, I want you to take a breath in and hold it. Okay, you can go ahead and breathe. All right, so I did not hear any bruits or transmitted or radiated murmurs. So now I'm going to take a look at the neck veins and see if there's any unusual pulsations, and then get an estimated measure of the central venous pressure. Okay, so first just turn your head to the left just a little bit for me, and I'm going to see where the pulsation is here with a little tangential light. Okay, that looks right there. Then turn your head towards me, and I'm going to do the same on the other side. And again, look for that jugular venous pulse, and it seems to be the top of the pulse right there. Okay, now just look straight ahead for me. Now I'm going to get an estimated measurement of that the height of that jugular venous pulsation. I'm going to put a little ruler here at your second intercostal space right over your right atrium. And then I'm going to find where this okay, and that appears to be about a ½ centimeter. Right there is the estimated height of the jugular venous pulsation, which as long as it's less than 4 centimeters, that is within the normal range. Okay, thank you. Okay, I'm going to do one last test where I look at your jugular venous pulsations. I'm going to be pushing on your liver for a few seconds. You can take a breath in and hold it, okay, and checking to see if there's any unusual pulsations. Okay, you can go ahead and breathe normally, and there was no abnormal rise in the jugular venous pulsation, and there's no evidence of heart failure. Okay, at this point now I'm going to examine your heart the same way we did with you sitting up, only with you lying on your back like this. And then when I'm done with that, I'm going to ask you to turn onto your left side, and I'm going to listen over your heart while you're on your left side, all right? Okay, so breathe normally unless I ask you to take a deep breath and hold it, or to hold your breath, all right? Okay, so first I'm just going to inspect the chest to see if there's any abnormal pulsations, any deformities or scars. I don't see any of those. The chest appears to be normal. I'm going to palpate over each of the heart valve areas like I did before, only this time I'm going to use the ball of my hand, checking for pulsations and thrills. The right upper sternal border, left upper sternal border, Erb's point, the tricuspid area, and the apical and PMI area. Okay, and I'm going to do the same thing using my fingertip. Okay, right upper and left upper sternal borders, left third interspace, tricuspid, right fourth interspace, left fourth interspace, and then the PMI and apical area. Okay, palpation is normal, no abnormal vibrations. I'm not palpating any lifts, heaves, or thrills with palpation as well. Before I listen to your heart, I'm going to do a rough measure of the size of your heart by tapping or percussing on your chest, all right? Okay, so I'm going to start at the left midclavicular line, fifth interspace, and come over to midline. And then I'm going to repeat that on the fourth and the third spaces. Okay, and the heart size percusses out normally. There's no evidence of cardiomegaly. At this point, I'm going to start listening to your heart. Now, this is a little different stethoscope than I used before. Instead of switching from bell to diaphragm, I'm just going to be changing pressures on there. And when I push lightly, that will pick up the low sounds, and when I push down hard, that will pick up the high sounds. So I'll be listening twice in the same areas as I did before. Okay, so just breathe normally unless I ask you to stop or to hold your breath. Okay, so I'm going to start up here at the right upper sternal border over the aortic area. Okay, first with firm pressure to pick up the high-pitched sounds. Okay, left upper sternal border, Erb's point, tricuspid area, okay, and the mitral or apical area. Okay, now I'm going to repeat the same thing, only with very light pressure. Right upper sternal border, left upper sternal border, or pulmonic. Okay, Erb's point. Okay, tricuspid area. Okay, take a deep breath in and hold it. Okay, let it out. Okay, going to listen over the apical area. Take a breath in. Hold it, let it out. Okay, very good. Okay, so did not detect any murmurs or abnormal sounds in this position. and I was able to auscultate normal physiologic splitting of the aortic and pulmonic second sounds, but I was not able to hear the splitting of the first sounds. Okay, now what I'm going to ask you to do is I'm going to have you turn onto your left side. I'm going to drop the head of the bed just a little bit to make it a little more comfortable for you. There you go. Okay, turn onto your left side. Okay, bring this arm up over here for me so I can get to your heart. Do you feel like you're secure there and you're not going to fall off? Mm-hmm. Okay, good. Lay down. Try to get as relaxed as possible. There you go. And I'm going to auscultate with the bell or light pressure over the apical impulse to detect any mitral stenosis. I want you to take a breath in. Okay, let it all the way out, and then hold it out when you get the breath all the way out. Okay, very good. Hold it. Okay, you can go ahead and breathe normally. All right, and I was unable to detect any murmur that would make me think that there's mitral stenosis. Okay, you can go ahead and breathe normally and go ahead and lay flat on your back again for me. Thank you. Okay, I'm going to do two more. These are actually special tests to listen to your heart. Since I need to make sure, I'm going to bring that up just a little bit more. The head of the bed needs to come up a little bit more. Very good. Okay, lay back for me. Okay, there you go. At the 30 degrees, I'm going to listen over the heart again, and what I'm going to ask you to do is take a big deep breath in, hold it, and then when I tell you to, I want you to release it, and then I'm going to listen to your heart while you do that. And we'll do that twice, both with the firm and the light pressure, all right? Okay, with the firm pressure, take a big deep breath in, hold it. Okay, let it out. Okay, breathe normally. Okay, now with the light pressure, take a big deep breath in, hold it, bear down real hard. Okay, let it out. Okay, breathe normally. Okay, very good. And the Valsalva maneuver was negative for any signs of hypertrophic cardiomyopathy. So at this point, I'm going to do another special test that tests for heart abnormality. I'm going to listen to your heart while you're standing, and then when you squat down, and then when you stand up again. Okay, so I'll need to have you sit up here for me, swing your feet around, and then stand up. We'll need the gown out of the way so that it doesn't interfere. Now, what I'll need you to do is I want you to stabilize with your left hand on the edge of the table there. Don't lean hard on it. It's just there to help you keep balance. Okay? And then I will be standing right next to you in case you feel like you're going to be falling over or something like that, all right? So first I'm going to listen with you standing. Okay? And this part I'm going to do first with light pressure, like a bell. Okay, go ahead and put your fingers over there by the table, and I want you to squat all the way down now, all the way down. Come on, all the way down, squat all the way down, all the way down. Okay, let's go ahead and stand up. Okay, we're going to do the same thing again. Do you feel okay? Mm-hmm. Okay, we're going to do the same thing again, only I'm going to be pushing with firm pressure. Okay, let's squat down again. All the way down, all the way down. Okay, and then stand all the way up. Okay, very good. And again, there were no abnormal findings with either the bell or the diaphragm that would make me think that there's a cardiac hypertrophy. Okay, thank you. All right, you go ahead and have a seat. And the cardiac exam was normal. Do you have any other questions at this point that I can answer for you? No. All right, so I'm going to go ahead. I'm going to leave the room, and I'll discuss the findings with Dr. Howe, and we'll come back and explain everything to you. And when I leave the room, you can go ahead and get dressed. All right? Okay, thank you.